wondered what somebody goes through during the last moments of their life, what kind of care they're receiving, and where they go to receive that care? I mean, if you think about it, not everyone's guaranteed to be 100% healthy, and there still isn't a cure for cancer. So you might have to think about it sometime. A woman named Cicely Saunders did think about it. She said, "You matter because of who you are. You matter the last moment of your life, and we will do all we can not only to help you die peacefully, but also to live until you die." I got that quote from the American Cancer Society website. You're probably thinking, who is that lady? Why is she important? She started her career as a nurse and then moved into social work and then earned a medical degree. She was the woman that introduced hospice care into the United States. People's fear of death and misconceptions surrounding hospice care prevent them from taking full advantage of the services offered. Today I will explain 3 main points: what hospice care is, who it pertains to, and who makes it successful. Hospice care was introduced into the United States 30-some years ago by Dr. Cicely Saunders, who was originally from London. Hospice care is a way to make the process of death as comfortable as possible for the patient and to make it a less scary thought for everyone. One thing people don't realize is that hospice care is covered through Medicare, Medicaid, and most private insurance benefits. An article by Stephen Connor, who has his PhD and specializes in palliative care, said that this is thanks to the hospice Medicare benefit, which was established in 1982 through amendments to the Social Security Act. The next topic I want to discuss is the care model that most hospice care facilities are based off of. This is the multidisciplinary team approach. This consists of people doing specific jobs but work as a synchronized team. In this team, there is a hospice nurse who does patient assessments, symptom management, and acts as a medium between the doctor and the patient. There's also a social worker who acts as a resource for legal and financial problems. There is also the grief and bereavement counselor, which discusses the losses of the patient with the patient, like the loss of body functions and the loss of the previous lifestyle. They also discuss the impending death with the patient and their family and friends, and they also talk about the death itself once the patient passes. In this team, there's also certified nursing assistants who provide personal cares and activities of daily living for the patient. There are also volunteers. They provide socialization for the patient, they listen and talk, and they also provide joy. And there also is non-denominational chaplains available who provide comfort for their spiritual needs. Another really big misconception about hospice care is that the care provided is the same for every patient, but that's wrong because each care plan is specifically tailored for each patient. Some patients may need a CNA twice a day, and some may need the CNA 24/7. Lastly, I want to discuss the 3 levels of service that the hospice care provides. The first is routine in-home care, which takes place in the patient's home, in a relative's home, or wherever they're currently living. The next is crisis care. The patient can call the hospice at any time, 24/7, and a nurse will be available to provide symptom management and anything else the patient may need. Those are the 2 main cares. The next one, not all hospices offer, which is the hospice inpatient care, which occurs in the hospice's facility, and they provide an acute level of care specifically to manage their symptoms. Each patient may have different symptoms, which could range from pain, nausea, vomiting, diarrhea, anxiety, anything you can name it. Another really big misconception is that hospice care is only called at the last minute. Hospice can be called within 6 months, a few weeks, or even a few days. Now that you know the benefits of hospice care, you should make sure that you give the last stages of life the same respect the beginning stages of life receive. The fear of death and dying is natural, but remember, with the help of hospice care, people can be more comfortable and make it a less scary thought. I also have a brochure and a binder full of information for hospice. And then I have just a short video. Make sure you all can see that.
I had a stepmother who had a terminal diagnosis when she was 33, and I was only 14. My journey began with Southern Care Hospice as a volunteer, when my mother-in-law was actually the volunteer coordinator, and I would spend my summers volunteering. When I first was touched with hospice, I was working in assisted living for Alzheimer's and dementia patients, and I had a patient that was referred into my building, and went to his home and did an assessment, and found that he was in dire straits. His family had little contact with him, and his house was full of animals. It was ironic to me to know a woman that was devoted to her job as a hospice volunteer coordinator to end up being on the other end of the spectrum as a patient on hospice. I saw hospice come in and take care of her. They took time to sit and talk to her about anything and everything. I got to see firsthand how hospice really works, where they can come into the home and resume care, allowing you to spend more quality time with that family member instead of in a hospital room or a nursing home. That they're able to stay at home and be as comfortable as possible. So I actually adopted one of the dogs and brought him home, Sadler, looking very healthy. But that patient came back to my facility and lived with me for a period of time, and then opted to hospice. And Southern Care came in and provided the most awesome service ever for that patient. His family was able to come in and actually live in our facility for a couple days with the hospice agency, and he died with great dignity and wonderful quality of life. Hospice care is a service that we are allowed to provide through the Medicare hospice benefit, which is Part A, which is the hospital part of Medicare. Services that we're able to provide to families to make sure that patients who have been certified with terminally ill diagnoses are able to receive end-of-life care. And the goal of hospice is to make sure that patients die with dignity, that they are never by themselves at the end of life, and to provide their families with compassion and comfort during that very difficult time of their life. Southern Care will not turn away a referral or a patient regarding their insurance, whether it's Medicare, Medicaid, private insurance, or even charity. Everybody has the right to be evaluated for hospice. In the past and even today, hospice was targeted toward patients with cancer. We've extended our level of care to those who have non-cancer diagnoses. For instance, kidney disease, cardiac problems, Alzheimer's, dementia. The type of care that we provide as a hospice agency is considered non-curative. We want to make sure that any patient that is looking to utilize hospice services is no longer seeking aggressive treatment. We want to make sure that they're ready to learn about their disease process and to receive the comfort and care and compassion that our nurses can provide to them. Some hospice patients don't have the luxury of having family in town with them. So what Southern Care does is whatever it takes, whether it be giving that patient a manicure, brushing their hair, having that social interaction of just talking with them, maybe reading to them. That's where we go the extra mile. Some of the things that make Southern Care different from other hospice agencies are our quick referral time. We want to make sure we get those patients as quickly as possible and to their families. We really believe that our nurses are experts in the field of hospice, which makes a huge difference when it comes to comfort for our patients. Some of the other things that make us different are our education. Southern Care provides a phenomenal amount of education, not just to our families and our patients, but also our referral sources and our physicians that come in contact with our patients. The people that work at Southern Care all have a heart for hospice. They've either had a personal encounter or because of their experience in their position, they are easy to empathize with the patient. That's what sets us apart. I believe in Southern Care and I support their services because I know the type of quality care that we provide. Southern Care has an awesome mission statement and an awesome philosophy, and our staff truly believe